And so Renee is coming. And we just go back to our presentation. And so we've read a couple of paragraphs from the leaflet about gastroscopy. And now, so the first and the second, okay. Now the next, just a paragraph from the leaflet, and let us listen to Pradeep, please.
Is gastroscopy reliable? Gastroscopy is a good test for seeing abnormalities in the upper gut. However, it's not foolproof. For example, gastroscopy may not detect a small number of cases of early ulcers or early cancer.
Not foolproof. Okay. Well, and so the next piece of information is for Rohita. Read it, please.
Yes, ma'am. Are there any side effects or complications from having a gastroscopy? Most gastroscopies are done without any problem. Some people have a mild sore throat for a day or so afterwards. You may feel tired or sleepy for several hours. You have a sedative. There is slightly increased risk of developing a chest infection or pneumonia following a gastroscopy.
Okay. And so also about complications, let us listen to Puranish, please.
Yes, ma'am. Occasionally, the endoscopy causes some damage to the gut. This may cause bleeding, an infection, and rarely perforation. If any of the following occur within 48 hours after a gastroscopy, consult a doctor immediately, which are some like abdominal pain, fever, difficulty in breathing, and vomiting blood. A small number of people have a heart attack or a stroke during or soon after a gastroscopy. These are serious complications, are rare in most people, or otherwise reasonably healthy.
Okay, thank you. And so there are some questions on the information that we've read. So let us listen to Sohita for the first question.
What do you need to do for 4 to 6 hours before the procedure? We need to stop eating. And also, if we are on any other medication, we have to stop that also.
Okay, good. Now, no, Khadija. She's coming. Now, Musharif.
How will the sedative make you feel? It will make you feel dizzy and sleepy.
Okay.
That's
That is why. Okay. So, and Mayuka, please, the next question.
What should you not do for 24 hours after the sedation? Maybe driving, traveling alone.
And the leaflet says also operating the other machines. Okay, because this is dangerous. Okay, Rina, please, the next question is for you.
What do you need after the operation?
What do you need? If sedation is involved, what do you need?
Rest.
Have a
You should
rest?
take rest.
Okay, yes. And Bhargavi, please.
Yes, ma'am. How successful are the results of the test? It's almost successful, but sometimes it may lead to infection.
What does the leaflet say about the just reliability of the test? Yes.
Yes, ma'am.
So it's effective only for seeing something in upper gut,
Yes.
but it can't. It cannot detect
Ulcers
ulcer
and cancers.
or the cancer. Mhm. Okay. So the next is for Vidya, please. Vidya.
What do some people have? What do some people have afterwards?
Mhm. Yes, this is about complications. So who can help us?
Like infections, bleeding.
Mm.
Heart stroke sometimes.
Heart stroke.
Yes, so with some people. Mhm. Okay. So this is the example of how the procedure is described in a leaflet. And now let us look at the next slide here. There are sentences that describe the procedure, and let us find the adverbs of frequency in the sentences and put them in the order starting with the least frequent. So in the first sentence, procedures like this are usually done under sedation. Where is the adverb of frequency?
Usually.
Usually, exactly. Then we often get patients who have no complications.
Often.
Often.
Okay.
Often.
Yes. Fortunately, we have never had a patient who has had serious complications with this procedure.
Fortunately.
Fortunately.
Never, ma'am.
Never.
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 Mhm. Okay. The procedure rarely goes wrong.
Rarely. Rarely.
You're right. It always takes me a while to recover from the anesthetic.
Always.
Always.
Mhm. And the last one, patients sometimes get a headache afterwards.
Sometimes.
Sometimes.
Okay. And if we start with the adverb of frequency, which shows that the action is the least frequent. So this is never, right? After never, what do we use after never?
Rarely.
Rarely, okay. Then?
Sometimes.
Sometimes.
Okay, then after sometimes?
Often.
Usually.
Often, then usually, and
Then always.
Always.
exactly, okay. So here they are. Usually and always. Okay, so these are the words that can be used in just in the process of explaining some complications to a patient. And let us think of the synonyms. What synonyms do you know for the adverbs of frequency? For rarely? What synonyms does it have?
Usually.
Okay, usually, rarely. No, rarely is not usually. This is
Hardly.
Not.
hardly. Okay,
Yes, hardly.
it's like
Infrequent.
yes, no, frequently, not very frequently. Yes, almost never.
Almost.
Mhm.
Almost.
Okay, for sometimes.
Occasionally.
From
Often.
time to time.
Okay. Then often, please. Often.
Regularly.
Okay.
Regular.
Usually.
Daily.
Generally.
General.
Routine.
Okay. Typically, we can say, right? So here they are. So the synonym is seldom, not often, now and then for sometimes, So for usually, habitually, generally, commonly. Okay, so just we should use these words in the project. We'll speak about this later. And now there is a listening task. And so before we start listening, let us focus one more time on the complications of a gastroscopy. Possible complications. What are they? The possible
Heart attack, rarely heart attack and
Pneumonia
strokes.
and strokes.
Infections.
but they are very just rare heart attacks.
Rare.
What are
Yeah.
the typical complications?
Blood
It may-
vomits,
Mm-hmm.
difficulty in
vomiting,
breathing,
fever.
Abdominal pain.
Okay. Sore throat. Yes.
yes, ma'am.
Okay.
Breathing difficulties.
Yes. Okay. In the chest. Pain in the chest. Okay. And now we are going to listen. And we should put down the list of complications the doctor mentions. Just make notes about this. And we should also focus on the words which the doctor uses instead of these words. Instead of occasionally, automatically, and seldom. The doctor uses other words. Okay, so side effects. Now let's start listening.
Listening 4.
Can you hear?
Yes, ma'am.
Okay, now.
Yes, ma'am.
Listening 4. Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut, and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
Okay, so what side effects does the doctor speak about?
Chest infections, pneumonia,
Sore
sore throat,
Drowsiness,
yes,
Drowsiness.
Tired.
pneumonia,
Pneumonia. Yes, okay.
chest pain,
Mhm.
bleeding,
Bleeding.
Mild sore.
Yes. Okay. And so why does the doctor point out the side effects? to the patient?
so that she should be aware of what she's going through, and so that she could sign the consent
Mhm.
form.
So the consent, which is called informed consent. Okay.
Yes.
And instead of the words which are given here, occasionally, automatically, seldom, what does the doctor use? Occasionally instead of occasionally. What does she say?
Odd, okay. Odd
Yes, she
occasion.
says on the odd occasion. Instead of automatically. She says that does not necessarily means necessarily, yeah. And instead of seldom,
Rarely.
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 Exactly. Okay. And so
Listening 4.
let's move to the next slide. And here we are going to listen again and list 3 ways the doctor makes the complications less threatening. She uses some conversational just formulas of words just to seem not so scary. Yes. Okay, just 3 ways that the doctor makes the complications less threatening. We're going to listen to the same information one more time.
Listening 4. Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure, and if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut, and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
So one of the ways that the doctor uses to sound less threatening, what is it?
Most cases are problem free.
Assure
Yes.
you that
Assure you that.
they are problem free.
Yes, she says
So
that.
that you can aware
Assure you
Does it mean
that. Okay, and the second way?
Aware of all the complications before you sign the consent.
it doesn't mean you'll necessarily get them?
Yes.
Yes.
So remember that this does not mean that you necessarily get these complications. Okay. And one more way.
Modification and
endoscopy
Rarely complicated.
Rarely bleeding.
It happens
It
very
might
rarely.
cause bleeding.
Yes. So I mean, the doctor should keep using the phrases that the reassuring phrases that the patient should feel comfortable with them. Okay, and
Listening.
so now we are going to speak about patients showing emotions. So when doctors say patients showing emotion, they can make a comment or observation, and this is called acknowledging a visual cue. So we should be able to read the emotions from patient faces and postures. And here you can see several pictures, and there are several statements. And our task is to match each picture with the statement. Okay. Well, let us read the sentences, the statements here. So, Povanesh, please.
It's better to let it. Yes, ma'am. It's better to let it all out rather than boiling it up.
So
The first one will.
Which picture does it match with the
C, I guess.
C? Because the patient is crying there, and
Yes,
the doctor just comments on this situation like this. Okay, so Hita.
You look very happy to be going home. It's picture D.
Yes, D, sure. Khadija, please.
I can see you are a bit alarmed by the procedure. It's F.
F, a bit alarmed. Okay, maybe F. Sharif?
You look rather nervous about this. It's F.
Okay, if we have two phrases like alarmed and nervous, so which picture illustrates alarmness?
Alarm, I think A.
A.
Alarm.
And
A, ma'am.
nervous
A.
person is nervous in picture F. Okay. Well, Mayuka, please, the next sentence.
I can see you are in pain. E.
E. Yes, sure. And Karina?
You look a bit confused by what I have said. Picture B, ma'am.
Picture B. Yes, the person is confused. Okay, and now if we have a look at the next slide, here we can see so more sentences. Just let us complete each doctor's response by adding the most suitable development to reassure. So the same sentences, and we should find the another phrase which matches them. Well, Bhargavi, please, number 1.
Yes, ma'am. It's better to let it all out rather than blotting it up.
And the next phrase, what is it?
Yes, ma'am. But remember, you're very lucky we caught it early.
Okay, okay. Other phrases?
You look very happy to be going home.
So
I won't keep you long.
The person is not happy. The patient is crying.
On the second sentence, I'm reading second sentence.
Yes.
Second one. You look very happy going home. So I won't keep you long.
Okay, so I mean, we start with yes, this is the second sentence. Yeah. Okay, sentence number 3. Vidya, please.
Yes, ma'am. I can see you are a bit alarmed by the procedure. So would you like me to go over it again
And get you something like to calm down, right?
Yes.
Okay. So, Lahari, please, the next sentence.
Yes, ma'am. You look rather nervous about this. But we will soon give you something to help you relax, so there is no need to worry.
Okay, yes, good phrase. Well, Manish, please, the next sentence.
I can see you are in pain.
So?
But we'll soon give you something to relax, so there is no need to worry.
Or would you like me to get you something? Yeah. Okay. So, Pradeep, please.
You look a bit confused by what I have said. Would you like me to get you something?
If a person is confused,
would you like me to go over it again for you?
But remember, you are very lucky we caught it early.
Okay.
It could be D1.
It could be D.
Yes, ma'am.
Go.
So would you
Yes,
like me
because
to
the
go
person
over
doesn't understand, and it's a good idea to go over it again one more time for him to explain the same procedure one more time. Okay, good. And here, if we have a look at this slide, there is a question. In your own country, what would you say to a worried patient, or what would you do? Would you say the similar phrases, or what? Who would like to speak?
Almost similar phrases.
Yes, ma'am.
And do people in your country just express just emotions in the open way, or do they tend to keep the emotions inside in your culture?
Most of the people won't show,
According
ma'am.
to
They kept,
situation, ma'am.
yeah.
It depends.
Yes, Bhargavi, please.
Most of the people won't show. They keep it for themselves, ma'am. They won't express much, and rarely they show, like crying.
And ma'am, in my country, like women feel comfortable talking to a female doctor about her problems. It's like this.
Yes. Okay, I see. I see. So, of course, well, we should keep in mind some cultural differences and the facts that you are speaking about when talking to the patients. You're right. And yes. Here on this slide, you can see the name of several procedures. And so don't ask me to read these words because they're too complicated to pronounce, especially the second one. The abbreviation is ERCP, but this very long word, I don't know how to pronounce it. Maybe you know better because you know what the word consists of, the parts that it consists of, and the suffixes that are used in this word. Okay, so this is about the assignment, the home assignment, and so you see that there are 6 procedures or tests here, and you should work with these assignments in pairs. 2 students should be working on each of the procedure, and you should prepare a leaflet that gives a patient information about one of these procedures. Of course, you should find the information somewhere on the internet or in the books. And also just use the example which we read, the leaflet that we read today, just what the leaflet should consist of. And as for, yes, the form, we should present the leaflet with the help of PowerPoint, and there are some instructions. So you should use bullet points if it is necessary, like for the stages of the procedure. And you should, in total, make no more than 5 slides. And you should write about each complications separately. Then, and you should use the following words and expressions to help you, like sometimes, occasionally, rarely, some people, there are some people, not everyone, and just adverbs of frequency, because you remember that these words can help patient, can help to reassure the patient. And you should use the present simple, active, and passive voice, and the imperative for actions. So, and yes, it should be done with the as a presentation in PowerPoint. And so we'll work with